Staying on the topic of health, do you or someone you know have asthma?
Well, Alex had a chance to explore the topic with a couple of experts.
Well, more than 22 million people in the U.S. have asthma and also asthma symptoms. Here to give us more information about managing it are Dr. Purvi Parikh and Tanya Winders, CEO of Allergy and Asthma Network. I want to thank you both for joining me this morning.
Thank you for having us.
So let's start with the symptoms of asthma. Dr. Parikh, let's start with you. What are those and what can people expect if they have asthma, or maybe they don't know that they have it?
Right, so common symptoms are coughing, wheezing, chest tightness, shortness of breath, and you don't need to have all of them to have asthma. Even just one of those could be a sign that you suffer from asthma.
I see, and there's something called uncontrolled asthma. What is that?
So uncontrolled asthma is when you have those symptoms that we just mentioned, even just more than once or twice per week, or if you wake up in the middle of the night with any of those symptoms, or if you're missing work or school because of these symptoms. And it could even mean only one, maybe emergency trip a year with these symptoms is enough to say that your asthma is uncontrolled.
Right. So with this and other diseases, people don't always go through the right steps to find out what they actually have. So how can doctors and patients alike sort of improve the dialogue about things like this?
So we learned from our open asthma survey, actually, that majority of the patients who thought they were well controlled, 70% of them were actually still having a lot of those warning symptoms and signals. And on top of that, most healthcare providers, 84%, felt that if they were controlled, they shouldn't be having any of those symptoms. So there is a disconnect. So the main thing is kind of during your routine office visits, having a very open dialogue that really gets to the root of who actually is controlled and who isn't.
Right, very good point. So Tanya, the doctor talked a little bit about the symptoms of asthma. Now, how does it affect someone's everyday life besides just those physical symptoms?
Sure. Well, at Allergy and Asthma Network, we literally get hundreds of calls from families just like my own each and every day who are walking through the journey of life with asthma. And what they tell us is that they think they're doing well. In fact, they think that they're managing their condition well. And yet, when you dig deeper, when you ask further questions, what you find is that they're limiting their activities, such as exercising or playing with their children outdoors, or they're using more medication than they need to.
So what you're saying is they don't have to just simply accept these symptoms, right? There's something they can do about it.
Absolutely. They can become engaged and empowered and educated, and certainly come to those visits with a better understanding, A, of what's going on with their own condition and how really this is impacting them on a daily basis. And then secondly, they can be more proactive in those discussions with their healthcare professional. In our open asthma survey, what we found is that patients and healthcare providers often have different recollections of what's actually occurring in those visits. So it's important to ask the right questions, but also to be an active health advocate for yourself when you have asthma.
Very good. And doctor, let's talk specifics a little bit. What does someone do to actually treat their asthma once they see a healthcare professional?
Right, so depending on the patient, there's various medications that we give to prevent asthma from flaring up and to control it. So there's different controller medications, and those vary depending on how severe your asthma is and what type of symptoms that you're having. So it's even more reason to have that discussion, because often even people who were on a controller medication in our survey were not controlled. So often you do need adjustments to your medications from time to time.
Yeah, that makes sense. Like anything else, it just takes optimizing what's right for you. Now, if someone wants to learn a little bit more about asthma, about managing their symptoms, about maybe finding a little bit more help about this, where can they go and learn more?
OpenAsthma.com is the website where you can learn more about the survey results, as well as get some of those helpful tips that we talked about earlier.
They were really helpful. I want to thank you both so much for joining us today and enlightening us about this topic.
Thank you.
Thank you.
All right, guys, and everybody else, stay right where you are. The Morning Blend will be right back.